You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Good morning, everyone, and welcome to the Health Hub. I'm Kathy Biasi, your host, and along with our producer, Alex Diaz, we would like to welcome you to our show this morning. Hey, Alex, how are you?
Good, thank you. Got lots of energy today.
Excellent.
Good. Sun is shining. It's good.
Sun is shining. It's a beautiful day. Today's show is being taped, so no opportunity for calling in, but please do feel free to follow us on all of our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on all three locations. And also feel free to email us at thh@radiomaria.ca if you want to make any suggestions for guests. If you have anything you'd like to talk about to us in that format, that's great. Or if you have any questions further to this show today with Dr. Zenker. And please do subscribe to our podcast. We are the Health Hub on iTunes, SoundCloud, Spotify, all your favorite podcast platforms. And as has been pointed out to me a couple of times, you may need to not put any spaces between the Health Hub. It may be all one word on some places like iTunes. So if you are looking for us, try both modes. No spaces between the words and spaces between the words. But if you do subscribe to our podcast, you don't need to worry about that. You will be informed right away when we have our new episodes up. But you can also find our podcasts on the Radio Maria Canada website, which is radiomaria.ca, and on my website, which is kathybiasi.com. So, Alex, we have a very pertinent conversation today with Dr. Zenker. We're talking about heart disease. About 1 in 12 Canadians aged 20 and over live with a diagnosed heart disease. Cardiovascular disease is an umbrella term that is used to describe many diseases of the circulatory system and the heart and blood vessels. And they are the leading cause of death in Canadian adults. What is good to note is because of our, as science takes us down the path, we have a better understanding of what causes heart disease. And more importantly, we have a better understanding about how to prevent heart disease. So when you're talking about integrative health and trying to, take your own health into your hands, things like reducing smoke or not smoking at all, staying active, that seems to be across the board for good health, eating a healthy diet, limiting alcohol, and maintaining a good weight. These are all extremely important to maintain in order to try and avoid the risk of heart disease. So it does affect, as mentioned, a number of people. Today, though, we're going to drill down a bit more, and we're going to talk about not only heart disease, but we will be discussing cholesterol and its implication in heart disease, but also the necessity for cholesterol. Anything that our body produces, virtually anything that our body is born to produce, is there for a reason. And cholesterol has been taking quite a hit as being, so detrimental. Of course, highly elevated cholesterol. And we'll also be really drilling down into the numbers. Cholesterol is not one number; it's made of a number of different. A good blood cholesterol panel is made up of a number of different keynotes. So, something that I really felt, I've dealt with high cholesterol myself. I am still dealing with high cholesterol, some of it mitigated by the medication that I have to take post cancer treatment. So this is something that is near and dear to me. And just going through this myself, I felt that I learned so much working with Dr. Zenker. and doing my own research, that I wanted to have her on the show so that she can share her knowledge with you, because there's so much more to cholesterol and heart disease than, we get in our standard blood work. So about Dr. Zenker, she is a board-certified family physician through the American Academy of Family Medicine, a board-certified practitioner in integrative medicine, certified practitioner in functional medicine through the Institute for Functional Medicine. She's certified Bredesen, I hope I'm saying that right, Bredesen training for Alzheimer prevention, and she is the founder of Trinity Integrative Medicine in Burnsville, Minnesota. Dr. Zenker has a particular concern for finding solutions to chronic health problems. She utilizes nutritional supplements and diet recommendations to assist traditional medicine in the treatment and prevention of chronic disease. She looks for root cause in chronic health problems and helps individuals use their own genetics to their benefit for better health, working around possible genetic blockages. She works aggressively to prevent memory loss, detoxification of toxins, increasing neurotransmitter levels when needed, and reducing inflammation and reestablishing gastrointestinal health. So she has a very deep and broad knowledge of many aspects of integrative health, and I'm very much looking forward to her educating all of us about heart disease and cholesterol. So everybody, please do stay tuned, and we will be back in just a few minutes.
I've been trying to run away from this false reality. No matter where I turn my back, you're always right in front of me. So I push you away, but I don't know that I'm wrong. I don't know the words to say to make my faith that strong. So I will pray to you right now to take away my sin, heal away my brokenness, and change this heart again. Without you I am nothing but a weak and dying man. So I will pray to you right now and change this heart again. What is going through the motions if my life is still the same? Every day's the same old puzzle, all the pieces rearranged, and I refuse your help out of my own selfish pride. Lord, I have so many masks to cover up and hide. So I will pray to you right now to take away my sin. Come heal away my brokenness and change this heart again. Without you I am nothing but a weak and a dying man. So I will pray to you right now, come change this heart again. So I will pray to you, my Lord, change this heart again.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back, everybody, and thank you for tuning in. And I'd like to welcome to our show Dr. Bernarda Zenker. Dr. Zenker, thank you so much for joining us today.
Thank you. It's a pleasure to be with you.
Now, you're in integrative health. You obviously have a passion for working systemically with people. Where is your primary focus? Is it within heart disease, or is this a specialty that you've taken on aside? Because obviously this is the conversation we're getting into, or where do your passions lie?
Oh, I love working with finding the root causes of an individual's struggle, areas that give them problems that they've not been able to ascertain and to figure out. And with cardiovascular disease, I'm particularly interested in the inflammation to the heart, because now what we're seeing is that inflammation in the heart correlates with inflammation of the brain. And so looking at both of those things together and trying to determine what is it that is pushing that inflammation. And what we now know is that inflammation in the body systemically can push that inflammation in the heart and brain, including things such as infections and environmental toxins or exposure to mold, mycotoxins. Those are all very fertile grounds for investigation looking at this.
When we talk about heart disease coming from, 20 years ago, before that, we have seen a progression where heart disease and survival is improving. So obviously, science and research is pushing us into the right direction. But we are moving into this discussion that we're going to have about cholesterol. Where do you see the major shift in focus? Are you seeing a major shift? I should go back. Are you seeing a major shift in focus now? And is this opening up a whole new conversation about cholesterol?
Oh, absolutely. The whole issue of cholesterol 10 years ago was look at your total cholesterol number and get it lowered. In the last 5 years, there's been much more focus on the actual particle numbers and the risk associated with the lipoprotein particle numbers giving more problems, leading to the atherosclerotic cardiovascular disease and inflammation. And in addition, what we've really learned over the last 5 to 10 years is how this cardiometabolic syndrome, is what it's called, is a combination of different metabolic dysfunctions that the bird's eye window of the house of cardiovascular cardiometabolic syndrome, the different windows you want to look through. It might be cholesterol management, dyslipidemia, but it might also present as a bird's eye window of insulin resistance, for example, impaired glucose tolerance, or it may only be, surfacing up, percolating up in someone's health problems as high blood pressure. So all of these are being a little bit, that central adiposity, overweight, are all the areas that we're now looking at of how does high cholesterol and these different dysfunctions overlap, correlate. So that's the state of the art at this time.
Well, let's take a step back here. Our body produces cholesterol, and I'm of the mind that if our body innately produces something for us, there is some reason for that. And I think cholesterol has taken quite a hit. And I think it'd be very enlightening for a lot of people to understand that we do need cholesterol. So maybe you could explain that to us.
Yes, cholesterol is absolutely needed. It's produced in the liver, and it is needed for hormone synthesis. And we have to have adequate cholesterol for hormone synthesis, such as progesterone, testosterone, and the estrogens. We also need cholesterol for the lipid formation of the brain. Regretfully, many clinicians, many doctors hone in on atherosclerosis, cardiovascular risk, without looking at the larger picture of needing lipids for the brain, needing lipids for hormone synthesis. And so there's a fine line there. Too much can be problematic and can push a person toward atherosclerosis, but you really want to be careful not to overdo it, because then you sacrifice the brain and you sacrifice the adrenal capacity to make the hormones. Does this make sense of what I'm saying, Kathy?
It really does. And what it kind of leads me down this path. And I was actually hoping to bring this topic up a little later, but in the flow of this conversation, the number one recommendation, maybe the number one medication out there, is a statin. And, if you're not integrative, an integrative physician, and you're just looking at the standard blood panel, the statin is the go-to medication solely to bring that number down without, and this is what I've experienced, without any type of digging down into the nuances of the numbers. So we get a standard panel here. Can over subscription either of the medication or the dosage, can it link to any sort of memory disease? I'm talking dementia, things like that, down the road. Has there been any link between a statin and further down the road, a link to dementia?
Absolutely. Just in my own personal practice, I have 3 patients, all men, brought to my practice by their wives. They each, and they didn't know each other. They're in different parts of the country. They each had been started on a statin because their total cholesterol was thought to be too elevated. And all 3 of these men began to form memory problems. One particular man couldn't find his way to work. He didn't recognize a bridge that he had crossed every day twice for 50 years. And he didn't even know where he was, nor did he recognize this body of water. And his wife brought him into me and said, could this be the statin medication? And what we did is we ran his numbers. His total cholesterol, because the statin had been driven down so low that it was sacrificing the lipid in his brain. And so for that particular individual, we got him off the statin. We changed his diet. We changed some of the problems that are now linked with causing high cholesterol, such as inflammation. And his numbers have risen back up somewhat. He's regained his memory, and his inflammation markers have markedly decreased. So there are ways that we can work with cholesterol without sacrificing other parts of the body, yet providing help to the heart. And that's what I think the big message that I would love to get to our listeners is that inflammation can push cholesterol, and we've got to put a lid on the reasons for the inflammation and use the functional approach rather than the medication approach.
You're not against statins, are you?
I'm not against statins if we have to have them, but I think the first line interventions should be the systemic interventions to decrease the causes of elevated cholesterol. If a patient has done all of that and they're still having plaque buildup in the coronary vessels, then I think that there are natural interventions that we can use, such as red yeast rice, to inhibit that atherosclerotic plaque from building.
Okay, so here's a question. We have this set number of what the ideal range of cholesterol is. Is there any reason to believe or assume that everything's status quo, inflammation is in check, there's no plaque buildup? These tests can all be done, correct?
Correct. Yes.
Is there any indication to believe that some people need to operate and function at a higher level, or is that not? I just want to make it perfectly clear whether you believe that we need to have cholesterol within a narrow range, or can there be fluctuation for some people? Is there a case where an individual, genetics or otherwise, can have everything else in check, yet their cholesterol level is high, or is that still always going to be a marker of concern?
There are some individuals that have very high elevated cholesterol that I've worked with. And when I have checked the cardiac plaque buildup in their blood vessels, in the coronary, the large vessels of the heart, their coronary calcium score is 0. They do not have high buildup of plaque in the coronary vessels. And if it's not built up in the coronary vessels, the reason we are, Kathy, concerned with cholesterol, let's back up and talk about that for a minute. The reason we're concerned with high cholesterol is the supposition that high cholesterol leads to atherosclerotic plaque, which can lead to a coronary heart event, a heart attack. Mm-hmm. But that's not necessarily always true. You may whistle clean coronary arteries with 0 plaque, yet still have high cholesterol. And in those individuals, and I have multiple of those individuals in my practice, I stress to them, eat an anti-inflammatory diet, make sure you're exercising, stay away from dense sugar-containing foods, and live an anti-inflammatory lifestyle. It's the inflammation in the liver that we think is pushing up the cholesterol levels.
Is there a reason to test the liver other than the production of cholesterol?
Oh, I always look at the liver the liver is the washing machine of the body. It is the major life-giving detoxification organ of the body. It brings toxins into the liver, converts toxins from lipid soluble to water soluble, and then allows the cleaning out of those toxins from the bloodstream. So you absolutely want to keep a window, an eye on liver function. If inflammation is high in the body, it's going to cause the liver to produce more cholesterol. Mm-hmm. That's the research from Dr. Mark Houston. The inflammation in the body can push up cholesterol formation in the liver. And so that's why I come back to this anti-inflammatory perspective of looking at the root causes of the inflammation in the body, the toxins, the infections, an inflammatory diet, eating too much sugar, and managing your cholesterol levels from that perspective first.
Cholesterol also has a healing effect on the arteries and veins, does it not? I mean, the buildup of plaque isn't just a mechanism of getting stuck, is it? Isn't it a reparatory function as well?
It is. Well, the glycocalyx within the endothelium, you really want a soothing balm for that. And within the cell walls, there are lipids, phosphatidylcholine, phosphatidylserine. The actual cholesterol molecule is not that component of phospholipids. That's a different component of phospholipids for the glycocalyx of the endothelium. And you need good amino acids, the proline and lysine as well, for the endothelium to function. And it's very helpful. Let me just mention this as well. Antioxidants can be extraordinarily helpful for the healing of the endothelium by preventing oxidative stress as that constant turnover and repair is occurring.
Well, tell me the difference between cholesterol and oxidized cholesterol. One is more detrimental than the other, I think, correct?
Oxidized cholesterol is more detrimental, yes. And it's the oxidation, this oxidative state that is inflammatory and can cause the buildup of the foam cells, the macrophage foam cells, oxidized LDL with the macrophages predispose to foam cells being formed in the bloodstream. And when you get an accumulation of the foam cells, they coagulate like a sticky goo that then attaches to the endothelium in the bloodstream, causing plaque.
Is oxidation of cholesterol, the cholesterol molecule, is that a reaction to inflammation?
Yes.
So
Yes.
if you are not inflamed, if you're keeping your inflammation low and your cholesterol is not oxidized, is it still potentially harmful?
I've always learned, Kathy, never to say never, but it is not as harmful.
That's harmful. Okay.
As harmful. That
Okay.
is a key, is preventing the oxidation of the LDL. And that's why, for example, high-dose vitamin C, if somebody is taking vitamin C every day, 4 times a day, it can help prevent the oxidation of LDL.
Interesting. Okay, we're going to take a quick break here. We're going to come right back and continue on with this conversation. So everybody, please join us in another couple of minutes.
Don't know how it is you looked at me and saw the person that I could be, awakening my heart, breaking through the dark, suddenly your grace, like sunlight burning at midnight, making my life something so beautiful, beautiful, mercy reaching to save me, all that I need, you are so beautiful, beautiful. Now there's a joy inside I can't contain, but even perfect days can end in rain. I know it's pouring down, I see you through the clouds, shining on my face, like sunlight burning at midnight, making my life something so beautiful, beautiful, mercy reaching to save me, all that I need, you are so beautiful, beautiful. I
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back, everybody. We're having a very important conversation, in my estimation, anyways, here of cholesterol and some wonderful information, again, that you can put in your tool belt. Dr. Zenker, if you had a patient coming into you with standard cholesterol levels that didn't read well, what is your go-to for testing and maybe even stepping it back, differentiating between what you consider a very comprehensive test versus the standard tests that are out there?
Sure. If somebody has high cholesterol, or if they even just want to know prevention, what is my best evaluation? I look at lipoprotein particle numbers. The test that I use in my practice is by SpectraCell. It is available in Canada and in many countries of the world. SpectraCell lipoprotein particle test. And here is why I love it. It breaks down the actual particle numbers of the lipoproteins, of the LDL particles themselves, whether it's LDL 3 and 4, which are the most atherogenic problem particles, versus some of the larger, fluffier particles, the LDL 1 and 2. It will actually give us the numbers. It will break it down. Here's why this is important. You may get a global number, such as on a standard routine cholesterol panel, saying, for example, that your LDL is 200. What we don't know is that level 200, for example, the problematic LDL 4, or is it the more protective, the LDL 1 and 2? And so when you get that range and you're able to fractionate it out, you can assess how much an individual really is at risk. In addition, on that particular test panel, what I absolutely love is that they will give me the Lp(a) cholesterol level. Lp(a). This is why Lp(a) is so important. It is the most atherogenic genetic particle that we know of. Someone can have an absolute picture-perfect cholesterol level and their Lp(a) be sky high. Here's why this is important. When you have oxidative stress in the body, that Lp(a) molecule can be cleaved off. It can be broken. It's connected to the LDL molecule by a disulfur bond. And if that disulfur bond gets broken because of high oxidative stress, it makes the LDL molecule extremely atherogenic. So in practical terms, what am I saying? I, for example, had a first-degree cousin in my family, total cholesterol perfectly normal, had gone in for his annual physical, picture-perfect health. 1 week later, he dropped dead of a massive heart attack. After he was a farmer, and I can only imagine he had been out farming, pulling machinery around, perhaps got dehydrated, maybe overheated, very high oxidative stress in his body. And the Lp(a) molecule got broken, giving the environment of massive stress, oxidative stress in the body, causing massive clotting. And he died of a massive heart attack right after he had been evaluated. He had had his annual physical. So it's those kinds of scenarios when we hear of that, I always worry about LP little a. If you have any test that you could obtain at your fingertips, I would recommend that the LPP test from SpectraCell, because it will give you your LP little a cholesterol, your fractionated LDL molecules, and it also gives homocysteine. Homocysteine is a very inflammatory product to the heart, and what we now know is that it's inflammatory to the brain. And the beauty of knowing your homocysteine is we also know that there are 7 nutrients that are needed to metabolize homocysteine. So if you have an elevated homocysteine, and I see that, I immediately will make sure that my patient is taking these 7 nutrients. And, let me put a plug in for how we evaluate those 7 nutrients with the SpectraCell test. It's the micronutrient test available through SpectraCell. It measures all 7 of those nutrients, and I can pinpoint which of the 7 nutrients are problematic for the homocysteine.
And this is how we met, right? This is I took those 2 tests. I'm also in a clinic that can write those tests, recommend those tests for people, and these correlated beautifully. And this is how we sort of began our relationship, was because of my testing. So I can tell everybody firsthand that A, they go hand in hand, and B, I found that being able to separate and dive down into the numbers was very heartening for me. I went from my standard test where I couldn't sleep at night because my numbers weren't good, to figuring out a lot more clearly as to why. And there were many, many reasons that that number can be not what we want it to be, aren't there? Medication, diet, all of these things can fit into this protocol of trying to improve. Medication can't be helped, but at least, personally on my avenue, having an understanding of where I was deficient and an understanding, a very much deeper understanding of cholesterol, it's helped me quite a bit. And I think that, Dr. Zenker, what you're saying is the more we know, the bigger the picture, the more pointed you can be and people can be with how they're going to tackle this, as opposed to just directly going on to a medication, which may in the end may be necessary, but lots of avenues that we can hit this by, correct?
Absolutely, absolutely. And Kathy, let me just mention also this LP little a. There are multiple cardiologists now that are writing that in the era of COVID-19, of the pandemic, that when a person gets the virus, that the virus itself can cause oxidative stress in the body. And it's the oxidative stress from the virus, one of the theories for rapid problems in certain individuals could be this underlying genetic problem of certain individuals, like my cousin that I just spoke about, having elevated LP little a. If there's any blood test that I would recommend for individuals to know about, it's you need to know your LP little a, because there are functional medicine recommendations that people can take to help prevent blood clotting from forming if they are predisposed to that in a state of oxidative stress. There are phytonutrients that are recommended to help put a lid on oxidative stress, such as curcumin. The curcuminoids are fabulous. Resveratrol. I use a lot of resveratrol in my practice from Japanese knotweed, that particular type of resveratrol. Those two together, curcumin and resveratrol, are terrific game changers for many, many individuals. A high dose vitamin C, I mentioned that earlier. The problem with vitamin C, high dose, is that it only stays in the body for about 3 hours. So ideally you need to take vitamin C every 3 to 4 hours while you're awake, whereas resveratrol and curcumin have a longer half-life. I have many patients take all three, again, to help decrease the oxidative stress in the body, which in turn is going to help that liver, keeping a lid on the oxidative stress in the liver so that it doesn't be triggered, so that it's not triggering off making of cholesterol so much.
It's, with our understanding of systems in the body, and I hope everybody, as you continue to listen to the show and you become more and more aware of how things are integrated, it is just such important information that Dr. Zenker is sharing with us. Before we hit the end of the show, there's the APOE genotype that comes up. I'm hearing that more and more in different avenues, but can you explain the significance, what it is, and the significance of that?
Sure. The APOE is an enzyme. It's genetically determined, and it's determined by genetically the combination of an allele from your mother and the allele from your father. And the APOE enzyme is an enzyme that helps to break down specific lipids in the body, the triglycerides. The normal genotype that we see in about 80% of individuals is what is called a 3-3. If you have a problematic genotype, such as a 3-4 or a 4-4, what that means is the enzyme doesn't work very well, and it doesn't break down the triglycerides very easily. Here is why that is a problem. An abundance of that lipid can predispose to atherosclerosis. And so if you know your APOE genetic polymorphism, your genetic type, in advance, you can take precautions. Here's an example. If someone were a 3-2 or a 2-2, that individual can consume triglycerides liberally. They burn through them, metabolizing them without difficulty. If you're a 3-4 or a 4-4, my advice to those patients is you want to be on a low triglyceride, low lipid diet. You want to be very cautious not to go overboard because genetically your body cannot break them down. If your body cannot break down that lipid, then you're predisposed to atherogenic plaque buildup. That's where we get into the problem with the foam cells in the coronary vessels forming cardiovascular plaque. Where this is important and where the research really delved into this is the APOE enzyme, initially with the heart, but now with the brain. If whatever is good for the heart, you just want to, realize that the mirror image in the same discussion is what is good for the brain. And an APO enzyme 3-4 or a 4-4 genotype is considered you're more at risk for dementia, atherosclerotic dementia occurring older in life, like in a person's 70s or 80s, when that plaque builds up to such an extent that circulation in the minor vessels of the brain is compromised. And so if we have individuals in their 40s or in their 50s, if they find out their APOE enzyme, there's a lot of prevention that we can do. And there are things that we can recommend from a functional perspective to increase circulation in those microvessels as well.
And this is from a genetic panel. This is not a nutrient panel or a
correct. It would be a genetic test It could be ordered separately, an APOE enzyme ordered separately, and it is a genetic marker. It's not on a nutrient panel or a lipid panel.
Would it be
Correct.
safe to say that if you have the APOE enzyme that is not the healthiest, this might come through as inflammation in the body?
It could,
It
yes.
could. Not
Yes.
necessarily, though.
Not necessarily. Not necessarily.
Well, it's interesting, with the advent of many people on the high fat diet and just doing it because it's, for whatever reasons. It's very important. We're getting more and more into precision nutrition and precision medicine and so forth. So understanding where your genes are at can be very key, because again, if this enzyme is not the one that is not the healthy one for you, being on a high fat diet may be extremely detrimental. Is that a correlation?
That is absolutely correct. The reason that a ketogenic high fat diet is recommended in terms of brain function is for the ketones that are created from the lipids that you consume. However, the downside is that if you have an APOE enzyme problem, that elevated lipid consumption can further lead to atherosclerotic plaque and compromising of your blood circulation. So that is why if you're going to be undertaking a ketogenic diet, it is very wise to understand your APOE status. Now, Kathy, many people can be advised to do a ketogenic diet, to undertake a ketogenic diet for the formation of ketones, because ketones it's an energy source that brain cells like. And that's why in some of our elderly that are having dementia issues, we do recommend ketogenic diets.
Yeah, as a therapy.
However, what's really, you have to look at the other side of the coin and know that APOE status. Can you break down those lipids that you may be taking in those individuals that may have a compromised ability, an APOE 3-4 or 4-4, yet need help with dementia and getting good energy to their brain? There are interventions such as ketones, exogenous ketones, that in powders that people can drink, mix up and drink in liquids that are now on the market. That is another way just to help circumvent the problem, where you follow a lower lipid diet to keep your fat consumption down because of your APOE, yet you can drink your exogenous ketones to help your brain.
Now, just before we get to the end of the show here, then, because this is a topic that has relevance, the ketogenic diet for many people, if they don't have their genetic panel done, but get the blood test done, if there's an elevated is there a linear connection between that enzyme and an elevated triglyceride level? Going the other way, if someone has a low triglyceride level, can they assume that their enzyme is probably working well?
You can, if there's an elevated triglyceride level, you have to worry about, could that be an APOE enzyme problem? Yes. If they have a low triglyceride level, that doesn't necessarily mean that your APOE is good.
Okay.
It just means that you're doing a good job not triggering off high triglyceride formation.
Okay.
And some of those things, as I had mentioned earlier, could be inflammatory diets, high sugar content, and so what you would want is an anti-inflammatory diet. You want to stay, you want to keep your blood sugars balanced. You want to, maintain good exercise. So one way it can be helpful, but it's not necessarily always the case that a low triglyceride means that you're home safe with a good APOE.
So lots of ways to examine and to figure out how our heart health is how our heart is functioning. And it's just, if there's one thing that I think we want to get to you is that there are many ways that we need to, as you said, many windows to examine heart health with. So I hope that, I know for me, Dr. Zenker has been a wealth of information, and I hope this has come across. It's a very deep dive into your health, and you need to have all of the answers in front of you so that you can actually work with your physician, work with your medical team to make proper decisions on what is correct for you. And just because it's been in the family doesn't necessarily mean that it's going to pass down to you. As we become this, this is going to be my my platform here. As we become more understanding of what good health is, maybe better than generations before, the importance of a good diet, the importance of moving and so forth. There are many vehicles that we can use. So understand you, get all the information you can. Dr. Zenker, it's been wonderful having you on the show. Can people get in touch with you? Are you taking patients, or is it consulting that is your primary focus right now?
Yes, I am taking new patients. I have my own private practice in Minnesota. It's at Trinity Integrative Medicine.com, TrinityIntegrativeMedicine.com. I do have patients internationally, and I love looking for root causes and giving recommendations of how we can go forward.
Wonderful. Thank you so much for taking the time to be on our show, Dr. Zenker.
Thank you so much for having me, Kathy. I appreciate it.
Everybody, we'll talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by